One of the most important things that you should be implementing if you have metabolic syndrome, 1 in 3 Americans struggle with this, and this is putting us at high risk for developing things like type 2 diabetes, heart disease, and stroke. And this is some of the easiest things that we work with our patients to reduce our risk for all of these factors. Check this out. The most important thing for metabolic syndrome is increasing your fiber. And this patient we saw in her microbiome analysis was very imbalanced in her belly, and she was not getting in enough prebiotics to support her leaky gut that she had. You want this gray bar to be along this black line, and you don't want these overgrowths. And once we started working on her nutrition and reducing her insulin resistance, her microbiome started to balance itself out, and she was able to lose some weight and reduce massive amounts of inflammation. One of the second best ways to also reduce our risk for metabolic syndrome, high blood pressure, obesity, and all things mentioned is intermittent fasting. But we want to make sure we're getting a nutrient-dense breakfast in first, because we assimilate our proteins, fats, and carbohydrates the best in the morning times versus at nighttime. We want to push that dinner time back earlier or skip it altogether certain days. This is what works best for a lot of our patients to reduce their insulin resistance and reduce all other things mentioned. So make sure your doctor is looking at your insulin levels and working with you to get them below 10. This is vital for our patients to start the healing process, as well as getting those triglycerides below 100 to start regulating healthy levels of cholesterol as well.